Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hi, this is Dr. Roy Kim. I'm here with Dr. Kristy Hamilton for another episode of the Beauty Scientists, where we talk about beauty, aesthetics, plastic surgery, and more. So thanks so much for joining me, Kristy.
Yes, it's so good to be here. So we're two board-certified plastic surgeons talking about everything beauty, surgery related, and our second episode today, we're talking about flawless skin today and tomorrow. So what is the present condition of what we can do to have really beautiful glowing skin, which we all want, healthy glowing skin, and then I'm going to ask you what future directions you think there are.
Yeah, so I think first we actually want to talk about, to me, exfoliating your skin, maybe fractional CO2 laser, stuff like that. What I tell my patients all the time is we want you to have new skin. We want your top layer skin to exfoliate. So there are different technologies that do it. You can actually scrub it. That's called dermabrasion or microdermabrasion. You can use chemicals. You can use light or laser, and there are different types of lasers. You can actually use RF energy, radio frequency energy. But what we wanted to talk about today was carbon dioxide laser. So it's a special type of light. It's been around for 25 years, but the newest advances have been with fractional CO2 lasers. If you could explain that.
Yes. So the original lasers, they would hit 100% of the surface of your face. So very powerful. Obviously, you're treating the whole surface of the skin, but also significant downtime. Like it could take up to a month for people to heal from this, and also more dangerous because there were no islands of untreated skin left. So the fractionated treatment, so fractionated like a fraction or a portion of the skin. So instead of treating 100% of the surface, we treat everything in tiny little dots. So you'll see videos of it where it's like in like a square. And what that means is that it's much safer. You can actually go deeper without being worried about causing scarring or having complications, because we know that there are bridges of untreated skin in between, and it results in much more rapid healing. So you can be, from a lighter treatment, completely healed in a week. I did one exactly 1 week ago in preparation for this.
Yes.
Or for stronger treatments that I'm doing for maybe more mature skin, 10, maybe 14 days, but it's a much nicer recovery than the original kind, and so it's made that technology more available. And so I do it. I think before we were maybe reserving it for like that much more damaged mature skin, and I'm doing it for people in their 30s like me now, and everybody in between, because it's a really, really nice way to stimulate collagen production. It affects texture, pore size, gold standard for acne scarring, pigment even, and then it incites a degree of skin tightening. And I love that because obviously I don't need a facelift, but I'm also trying to do everything I can to cinch everything up, because I also recognize that I'm not 25 and things look a little bit different than they were before. And I'm trying to get back to that.
So this is one of the fun things about being a plastic surgeon. We could do this stuff on ourselves all day long. The other thing too is that you're right about the CO2. It's got maybe a bad rap with people who got it too often and full blast. With the fractionated portion, it's less blast. So how often do you recommend patients get this?
So I tell my patients is I think twice a year. That's like beautiful. That's nice that people can do that. And then they go, well, how often do you do it? And I'm like, well, maybe every 2 to 3 months, because I just love it so much. But I also don't mind like having a little bit of that downtime, and I do lighter settings, and I very unabashedly am in the office flaky and red, and that doesn't bother me. Like other people might feel a little bit self-conscious walking around like that, but I think if you're doing an intensive one, I think 1 to 2 times a year is appropriate. And then of course you have to be cautious, like what types of skin you're doing this in. So this is really more appropriate for lighter skin tones. Definitely a Fitzpatrick type 1 and 2, which is the scale of, talks about how much melanin is in your skin. But I will do lighter settings with an appropriate skin prep on Asian skin, Hispanic skin, Middle Eastern skin, but I put a little bit bit more effort into getting those patients ready. And often I'll put them on a pigment blocker in advance and watch them a little bit more closely after the fact because they've got more propensity towards hyperpigmentation.
Yeah, so for those out there who don't know about the skin texture color, it's mainly color. There's Fitzpatrick classification. That's dermatological / medical, 1, 2, 3, 4, 5, 6. So 1 is very fair skin, 6 is very dark skin. And laser really works best in Fitzpatrick classification skin 1 or 2. In other words, very light skin because the light can pass through the skin. If you have darker skin, the pigment absorbs the light on the way through. So the laser can't hit the correct deeper layers. So there's an increased risk for injury. It doesn't work that well, or scar formation. So in America, I like to joke, most people are mutts. So specifically, I don't think that most people are Fitzpatrick classification 1 because I don't think a lot of Americans are 100% Northern European. If you have ethnicity from, I don't know, Spain, Italy, the Mediterranean, something like that, you could actually be very fair skinned, but you should be cautious about the fractionated CO2 laser or any laser getting the max setting. So that's just one concern out there.
I couldn't agree more. And that's why I think it's really important to ask patients like what their ethnicity is, because you can even have patients that like they look really, really fair. But if you ask like, oh, yes, like my mom's Italian or, you know, my dad's from Spain, like there's that ability to produce melanin. And so that's what we're really worrying about is that like that heat is going to stimulate the melanin production and cause some unwanted hyperpigmentation. And so what I'll do is I'll put patients on hydroquinone. We've even been doing TXA, which has worked really beautifully after the fact, and some like more aggressive with their topical regimen. And then we always do lighter settings. But I think if you're conservative, then those patients that are 3 or maybe even a 4 with proper preparation can do it. I wouldn't do it for 5 or 6. Then I would switch to maybe a chemical peel. What do you offer patients? That are have more melanin in their skin?
Yeah, I mean, essentially, I do offer the classics, which are TCA or phenol. For those out there, that's tricarboxylic acid and phenol, 2 different chemicals. Those are the mainstays for chemical peel. They work great. They are prescription only, so you definitely have to be careful in terms of who's doing it. And I am careful watching patients. Phenol rarely can have cardiac issues, so this is why I typically do it in the operating room with monitoring with a facelift at the same time, or certainly under some type of monitoring, just out of paranoia sake. And probably similar for you. Any other chemicals that you like?
No, I stick with I haven't even ventured to the phenol side. I will usually bring my fractionated CO2 laser to the operating room, and I'll use that for around the mouth for my facelift patients. But the deep peels work beautifully, and the phenol peel, actually, that's been trending on TikTok lately, because that's big drama, right?
Yes.
How that looks. So it's like it turns dark brown, it looks like a mask, and then you just like crack and emerge like a butterfly. And I feel like, you know, even with the TCA peels, the lighter one, sometimes it looks like that, but the phenol peel is like really, really, really dramatic and can have some really gorgeous results. So we have a lot of great options today. And I think now, even more so, we've talked about fractionated treatment for accelerating recovery. And then there's all these new and exciting post-procedure treatments that we're doing now. Exosomes was the newest for me, and PRP as well, which I know you're into the PRP for sure for a variety of reasons. But should we start with that one?
Yeah, PRP, platelet-rich plasma. Basically, you take some blood, spin it in some type of centrifuge. Sometimes it's a special centrifuge. Sometimes there are different chemicals inside the test tube, and you get PRP. So this is the wonderful substance. It looks yellow, not red, and it has a lot of extra growth factors. So when used in non-plastic surgery, I mean, this is the stuff that they inject into knees to hopefully induce cartilage growth. It's injected at the bottom, actually, of your teeth. The oral surgeons use it to try to salvage your teeth or help the teeth attach to your bones. It's used in hand surgery for tennis elbow. And aesthetically, it actually helps things grow better. So more specifically, it helps things with healing. It helps with growth of collagen. And we joked about this before, Kristy. If you had a cut and went to the ER, like you cut your knee, if you had to have it sutured closed, it'd be better if the ER doctor sucked away some PRP, injected it in the area, as well as closed the laceration, because your healing actually should be better with that little PRP injection. Now, health insurance won't cover PRP treatment in the emergency room, but certainly when we use it for any aesthetic procedure that doesn't blast away the PRP, then I think that's great. So injectables with filler, injectables where you could do it with RF microneedling, which doesn't heat up too much as opposed to laser. PRP is great to actually regenerate thinning hair. So if you have some hair, but it's thinning, it will grow it back to about 20-30%. I think the papers usually say 30%. And there you go. Do you use PRP?
Yes, I love it for the injections. I'll do it as a topical afterwards. So I'll even do it with the fractionated CO2 laser. So not at the same time, but after you've created those little microchannels in the skin, I'm like, oh, this is like almost like a drug delivery system. So once everything's calmed down, I agree, you shouldn't blast it on your face, but afterwards, I feel like it's a good recovery product, and it's an opportunity to get those growth factors and the PRP in there. And it's the same concept behind the exosomes as well. Those also, so those contain, it's like part of the cell. There's like these tiny little vesicles, and they contain growth factors too. And so that's been a really exciting way to kind of accelerate recovery after some of these more intense treatments by applying that after the fact. Again, you can layer all these exosomes on your face. Like I could do it right now, and that'll just be an expensive, mask I'll do, but they can't penetrate because the molecules are too large. So when whether it's something as simple as skin pen or microneedling or creating these channels, I think it's a great way to get all those materials into your skin.
Yeah,
makes it work for you.
Yeah, for consumers or patients, of course, the skin has pores. Your pores actually aren't big enough for PRP or exosomes to go into the holes, go into the pores and get absorbed. Well, you know what? If we're creating holes with microneedling, if we are creating small holes with like a little burn wound that needs to heal from the fractionated CO2 laser, your skin can then absorb the exosomes, can then absorb the PRP. It helps with healing, but obviously it actually gives you a more youthful appearance. It increases collagen growth, and your skin looks better. I mean, it's more collagen, feels smoother, better skin tone, more consistent skin tone. There's really no downside, especially since, it's your own tissue. Exosomes are not, of course, but PRP, it's your own blood. So there you go.
Yeah. And then the exosomes, it's like the mRNA. It's not like the DNA of other people. So I think people feel like you're okay with getting the COVID vaccine, you're okay with the exosomes. But I think the PRP, speaking of like COVID and hair loss and stress, I think PRP injections in my practice have become more popular for sure. We've seen a lot more people finding out about it and then asking for it because there's been a lot of hair loss in the last 2 years, I think. I don't know if it's due to the pandemic itself. There's been a lot more stress for everybody. So that certainly has contributed, but we're seeing a lot more thinning of hair. And I'm not really entirely sure why.
I don't know. I mean, I haven't noticed more thinning hair. What I've noticed is more people talking about it. So, and the fact that you can actually do something about it, including nutritional supplements, nutraceuticals, the traditional stuff of, minoxidil, as well as PRP, which is newer and actually works. That's the amazing thing.
Yes, I do it on my scalp, and I've definitely seen some thickening because I'm always trying to grow a lion's mane. So I like it too. And I've seen it. I've seen it in my anesthesiologist loves it. So we started and he is skeptical but he did it a couple of times and he was like, finally he was like, can we do it again? I was like, oh, why? And he's like, I see it. The hair is growing back. And I was like, okay, if he likes it, this is the real deal. But more and more data supporting that.
Oh yeah. For patients out there, if you're completely bald, you have no hair, you have true scalp, it actually won't work. You have to have some hair or thinning hair, and it will work. Now, how well it works, that depends on your body, but it will work. And I don't know what you recommend in terms of PRP injections and how often. I think theoretically a patient could come in every 4 to 8 weeks, maybe 4 to 6 weeks, and get it done that often. Of course, for patients, it gets sort of pricey. Since we have access to it, as plastic surgeons, we could do it more frequently. And so it's definitely, you want to do 3-4 treatments, I think, before you see a result. I don't know. What's your opinion on that?
Again, so not based on data. I have patients and myself, I do it monthly. And I've had other patients see good results with that. What I generally recommend for people, I think enough to see a difference is, like you said, 3 sessions, 1 month apart. And then after that, like once you've seen that it is helping you, then a biannual treatment as supportive therapy afterwards to keep the hair growing.
Yeah. Well, speaking of newer things and specifically neurotoxin, there is Daxxify, which is a new neurotoxin competitor to Botox made by Revance. So Botox is the granddaddy of them all. Been about 21 years now that we all know it and we all love it. It relaxes your muscles, and the muscles that cause the wrinkles, if they don't work as well, the wrinkles look better. There are competitors, of course, in the US. There's Dysport and Xeomin, and there's Jeuveau. What's interesting is that all the 4 products I named theoretically last about 3 to 4 months. I think the FDA label says 3 months. Daxxify is the botulinum toxin molecule with a special protein latched onto it, and it lasts 6 months. And I noticed that you posted recently that you injected some, so you look aesthetically pleasing as always. So it seems to be working. The question would be how long, like it hasn't been 6 months yet. It has been out for 6 months. So the question is, will it last 6 months?
That's true. And I'll have to wait until July to really be able to answer that question properly. But, my initial concern was, okay, is it going to be really, really heavy? Because if it's lasting that much longer, are we going to stay in that kind of heavy, immediate post-Botox period for longer? And I found that I don't feel like that's true. I chickened out and I only did between my brows and around my eyes so I could get, nothing that would give me a droopy brow. So I did that first, let it kick in, saw that. I was like, okay, I did my usual amounts, liked how that looked. And then I went back in a staggered fashion and did my forehead. So what I realized is I think I can do it the way I normally like to do it, which is a little bit lighter in the horizontal lines, because that frontalis muscle is the only one that actively lifts your brows. And then I feel more confident with a newer product putting more between the brows and around the eyes, because those muscles actively depress. So if you can soften those, I don't have to worry about having a heavy brow, and I want that nice fresh look. So I think so far what I can say is I like it. I was not one of those people where it kicked in full effect 8 hours later. I saw those videos going around the internet. They're like, I injected it and it's been 6 hours and it's fully kicked in. Mine really did take I would say like at least a week. Before I was like, okay, here we are. Because I almost the next day I woke up and I was kind of disappointed because I was like, oh, it's like not fully kicked in after 8 hours like everyone else. So I think give it the appropriate amount of time, and I think it's exciting because I think a lot of people, they're really busy. They don't necessarily want to come in every 3 months if they're trying to maintain. And I was like, if you only have to come in twice a year, and I know they're doing studies to see if it actually will last even up to 9 months. I'll be curious. I think that's exciting. There's also this group of, I don't know if you see these patients too. I have a lot of women in their 30s who are patients of mine. And so they'll come in going, freeze me out because I'm trying to get pregnant, or we're doing like an IVF, an embryo transfer. And I know I'm not going to be able to get neurotoxin for like a year and a half or 2 years. So go. So I was like, this is going to be, instead of just doing boatloads of Botox and just trying to create that really smooth, shiny look, I was like, this might be a nice option too, where they can have that ongoing, if you were able to time it right.
Right. I have some of those patients as well. And it's interesting because in the past, some people have definitely tried Botox/Dysport/Xeomin/Juvo. Could you give me a double dose? Could you give me an extra dose? And it does work better. And anecdotally, it may work maybe 4 months instead of 3 months, but it doesn't work like 6 months or 8 months. It wears off after a while. So the other thing with Daxxify as well is it has different dosing. So this is semi-controversial where people say, hey, I got 10 units of Botox here, but that's 30 units of Dysport there, but that's too many units. And it's like, well, the ratio is 1:3. So I actually got the same dosing. So Daxxify, I know they're consumers are sometimes confused, but I know that the unit dosing is different.
Yes, it's 2 to 1. So it'll be I was like, couldn't you guys have chosen one or the other? Couldn't make it like 3 like Dysport or just one like Botox. So
right.
So yes, I think it ends up like in our practice at least being more cost effective than just like double like 2 Botox treatments stacked. So that's kind of nice. Although I think pricing will kind of vary across the country. But yeah, so you have to, whatever number of units you're used to getting for your Botox, double it. And that's the number of units you'll be walking out with if we're trying to keep you on the same sort of look that you had before.
Right. So 10 units of Botox would be 20 units of Daxxify.
Correct. Yes.
Because
that's always scary. If someone's used to getting 20 here and you walk out, you're like, you got 40 units. They're like, wait,
exactly.
Why? And then people have had Botox and they're used to being in like the 40. You're like, you had 100 and something units of Dysport. And they're like, oh my God, my face is never going to move ever again. But I guess just marketing tactics, I suppose.
A part of it's that, and part of it is like it's a different botulinum toxin molecule. So to get the same effectiveness, all the FDA studies have shown different units, but maybe it is marketing because you have to get more units, but who knows? Yeah.
I think to me, it made sense with Dysport that then they could be like, oh, like the unit is a third of the price. So you're like, oh, you get so much more value out of it, but surprise, you need 3. It's a third of the price with 3 times the number of units. That's exactly
right. So
exactly
it's the same price. Yeah. And I know that in terms of pricing with Daxxify, it's the same thing. Like, how come it costs twice as much? Well, you're getting the same number of units, same amount of power, but it lasts twice as long. So
so that at least makes sense to people, like in their minds. But yes, I will have to report back in July, and we'll see how I'm looking. I'll have to come see you.
Well, we can just crinkle every time we see each other online, and then we can see. Yeah, exactly. That's a good look. And so, how long has it been? About a month?
I guess like 3 weeks now, and then I did the laser on top of that, so I'm feeling very sleek, very aerodynamic right now.
Well, yeah, I need to resume with like my Botox/neurotoxin injections. I haven't had any in like 6 months, so I need some more immediately. And
so
that way,
I was gonna say, so that's a good question. So like, what, as a male plastic surgeon, what do you do for yourself? Like, what is I know we get busy sometimes and we don't, but as someone who has access to everything, what do you do for yourself?
Honestly, not very much. I do use sunscreen on the weekends. I think that some sun exposure is better for your skin. And since like I'm waking up at 5 in the morning and I don't see the sun a lot, I don't feel the need to use sunscreen. Also, like Northern California is not that sunny compared to, Houston. So that's why. I do use hydroquinone and Retin-A like twice a week. And I should get Botox more frequently. I don't know. I guess I'm lazy.
Yeah.
But yeah. I definitely have friends who can shoot me up, and of course, I can shoot myself up. I've never injected in my face yet.
You've never done Botox ever?
I've done Botox. I haven't self-injected. I've always had someone else inject it for me.
So I've only injected myself. And the reason for that, it was like born out of like, just like training, and they give you like a little sample and you just like throw it in your bag and like take it home, and it's sitting in your fridge and you're like, okay, well, there's only one way this is going to get anywhere in my face. And so I've the only person who's ever injected anything in me is me. So it just takes a little bit of angling in the mirror, but that way I know it's fun for me when I test things out. I know like I do it the same way 100% to myself every time, so I think at least that part's kind of controlled. But I think it's nicer to have someone else inject you. You kind of relax a little bit more.
Yeah. And so I haven't had a major like facial treatment, specifically laser, chemical, RF, so whatever energy where my skin is flaking off a huge amount. So I should start doing that. And again, it's hard. Like I would say it's almost impossible to have some laser machine self-inflicted. Probably wouldn't be safe either because you have to cover your eyes, but then you sort of need to look at the same time. So that's an issue. But yeah I mean, I need that. And then, I work with a fantastic nurse who is my business partner in SoCal. So Eunice. And so she has injected me in the past. She's done a great job. But it's been a couple months, so she needs to inject me again.
Yeah, she's very talented, and she does a beautiful work for sure.
Yeah, she's fantastic. And also, I don't have to like look grumpy in the mirror, like make faces and then like inject myself.
So to your point, I put that out there as well. My amazing team does my lasers for me. So you're right, 100%. You cannot do that. And same thing with radio frequency microneedling. I've used the skin pen microneedling. Mm-hmm. I've done that to myself before, especially if you're so numb with the topicals, like it doesn't even hurt. It's too hard to apply force, I think, on your face as you're trying to stamp the radio frequency microneedling in. So I guess all those skin treatments, I'm fortunate enough to have other people that will safely administer those to me. But I like to do all the injections myself.
Well, I mean, that's, it's I'm sure people are wondering, like, how can I get a job where I can take Botox from the workplace and then put it in my fridge and then do it later at night? Sorry, you have to be a board certified plastic surgeon or dermatologist or something like that. But yeah, you could join us. So there you go.
Yeah. We're very open. We're always welcoming new people in. Now I do it in my office, but yeah, that was like the residency training days. I was like, oh my gosh, yes, a little Botox sample, put it in my purse,
That's right.
Put it on ice, race it home.
Yes.
But yes, no, it's exciting. There's always new treatments coming out, new topicals. I think some things remain the same, right? I think we have like the workhorses of the Retin-A that helps turn over the skin and build collagen. Some of these laser treatments, the neuromodulators, have now just become like standard. Everyone's doing it as preventative, baby Botox. But I think like future direction, it would be nice to see more lasers that can treat everybody safely, regardless of skin type, and then just additional ways to keep on accelerating recovery so that maybe we're preventing the collagen breakdown more easily so that we don't have to do as many of these ablative treatments.
Yeah, anything really to control the muscles that cause wrinkle, as the neuromodulators, as well as anything to get rid of the top layer skin, and the new skin that grows underneath is better. More collagen, more youthful, more consistent color tone, fewer wrinkles. I mean, everything's better about it, and there are different ways to do it. We can always help, regardless of background, ethnicity, age, skin type, whatever. We can definitely help.
Yes, and I think people really...
Yeah. Go ahead.
Oh, I was going to say my last comment on that was, and people love that because they're not feeling like they're putting any materials in their face. So for those who like don't like the idea of Botox or other injectables, like this is just having your own skin do the work that it knows how to do. It knows how to repair itself. So sometimes it gets a little lazy. And so this is a way to kind of kickstart it back in. But
Yeah.
Thank you, Roy. This has been a delightful conversation as always. I always learn so much from you.
Oh, well, thanks so much. And then, as always, for our viewers out there, if you have any future topics, questions, comments, please fire away below. And we look forward to seeing all of you again.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.